Woman on the Way. Jasmine arrived on a vessel packed with more than 800 people. Many of them had been huddled together on top of one another in the hold, and all of them were doing badly. By the time they were on land, Jasmine's waters had broken. There was no time to take her to Palermo. Her child would not have made it. So I tried to keep her calm while I did an ultrasound and showed her the tiny heart and head of her daughter, who was in fetal distress. I decided to perform an episiotomy, a surgical cut at the opening of the vagina, a risky but necessary procedure. The delivery went smoothly, and Jasmine gave birth to a perfect little baby girl. She decided to name her Gift. It is invariably a joy to see a mother smile when her child is born, but what happened next was a surprise. I came out of the operating room late at night, covered in blood and exhausted, to find a crowd of women waiting outside. They were Lampudes and Mama, who had brought Gift everything she could possibly need. Nappies, baby clothes, toys. It was at that time that I realized we needed better facilities for children at the clinic. The women who were pregnant often had young children who would watch the doctor fearfully as he took their mother off to a room full of strange machines. We had the simple idea of setting up a cheerfully decorated playroom next to the examination room, with plenty of toys and games to keep the little ones busy while they waited. It worked so well that children did not want to leave when it was time to go, though they could usually be coaxed out again with a small present. In the spring of 2016, one boat brought in 3 pregnant women, including one from Nigeria named Joy. She was in her 4th month and alone because the traffickers had forcibly separated her from her husband. She had been ordered to one side and he to another, and both were powerless to object. The traffickers had raped her, then bundled her onto a boat. She had no news of her husband. "Please help me find him," she implored me. "I don't want my son to grow up without a father. We have risked everything so that he could be born in a better country. You can find him, please. I'm begging you." Sometimes, when I am the only friendly face in front of them, patients feel as if I am no longer their doctor, but a savior who can give them back their loved ones and reunite their families. Regrettably, as in Joy's case, this is not always within my power. At other times, I am simply the only person in whom they dare confide the unabridged horror of their plight. Too often, when I have performed an ultrasound, the patient makes the same heartbreaking request: to abort a fetus conceived not of love, but of rape. One day, a Nigerian 17-year-old named Sarah arrived at the clinic. She told us over and over that she had wanted to die. The other young girls who had been traveling with her told us that Sarah had made several attempts on her own life. In the ward, she threw herself off a stretcher in a desperate effort to end it all. We did an ultrasound that revealed she was 18 weeks pregnant. I tried to show her the screen, but she could not stop crying. There, I said. "Everything will work out, you'll see." But who was I to console her? Sarah looked me straight in the eyes. "I do not even know who the father of this child is," she said. "I was raped by 5 men. They took turns and only stopped when they had run out of energy to torture me. What do you think, doctor? What is this thing inside me going to mean to me, now and forever?" Her story enraged me. Those evil things. I could not possibly condemn her decision. I called the doctors and social workers at the health authority in Palermo. She was transferred there by helicopter the following day. She had an abortion and is now being cared for in a shelter. Many girls only tell me of attacks like this because they say they need to rid themselves of a burden they cannot share with anyone else. They often ask for a secret abortion, either because letting people know would only double their shame, or because they are afraid their families will disown them if they find out. Countless pregnant women have washed up on Lampedusa over the years. One night, 5 came ashore in a group of motorboats, one of whom was in her 8th month and in agony. I cannot take her to the clinic right away because I had to go on examining the other refugees. I asked my colleague Elena, who is both a doctor and an interpreter, to take her and said I would get there when I could. Do an ultrasound right away, I said. She should not be in this much pain. After finishing up my rounds on the pier, I went back to the clinic. There I found Elena. She had been crying and her eyes were red. What's the matter? I said. The girl who was in pain, I think her child may be dead. I went straight to the ultrasound room and examined her again. Elena was right. The baby's heart had stopped beating. It had not survived the exhausting journey and its mother's stress. The young woman understood immediately. There was no joy in our faces. We did not invite her to look at the screen that would only have shown her a tiny inert body. When we gave her the bad news, she said nothing. She closed her eyes, tears ran down her face, and she wept silently. We decided to transfer her to Palermo. I called the social workers and asked them to keep an eye on her, support her, and make sure she did not feel alone. At the hospital, they operated on her. She had been carrying a baby boy. When they reported this back to me, I felt awful. We had not even checked the baby's sex during the ultrasounds. We hadn't had the heart. After being discharged from the hospital, the girl was transferred to a refugee shelter for young women. I never found out what became of her. The wounds you cannot see. I grew up in a big family. There were 7 of us, 5 girls and 2 boys. My brother, Mamo, was 1.5 years old when he contracted meningitis. Back then, the disease was rarely diagnosed quickly enough to prevent long-term repercussions. Memo suffered brain damage so severe that my parents had to send him to a mental asylum. On Lampedusa, no one knew what it meant to have a mental disability. Local families were not in a position to take on such a heavy responsibility. Every time my mother came back from seeing Memo at the institution in Agrigento, she seemed shaken, almost a different person. So one day I insisted on going with her. I wanted to know why she found the visits so painful. She did take me, but when we got there, I almost wished she hadn't. My brother was naked, covered in bruises and scratches, pacing back and forth in what seemed to be an enormous nowhere. His world was in total darkness. There was no color, and above all, no heat. The floor was effectively a hideous latrine. Everything was filthy. The sheets were stained. The mattresses reeked of urine. There was no trace of human dignity in the asylum, and the poor souls who resided there were restlessly drifting in a hell that only worsened their inner torment. I was horrified. I wanted to take my brother away with me, but I knew we could not do that. On the way back, I thought long and hard about what I had witnessed. I was having trouble coming to terms with it. Now I understood why my mother always came home with a pained, almost contorted look on her face. It was the crushed expression of someone who knows they can do nothing to help the person they love most in the world, their own child. After a lengthy and complicated legal battle, the mental asylum was eventually shut down. We were able to transfer my brother to a care home in Aragona. It was a small relief to my parents and to myself. But for years afterward, the abuse Memo had suffered went on eating away at me like woodworm. It was a wrong that could never be righted, and it left me with a constant niggling sense of unease. At the university, I resolved to learn more about this issue. I read all about Franco Basaglia, the Venetian psychiatrist who revolutionized care for mentally ill patients. I realized that we had to provide a place in Lampedusa for children and young people with mental disabilities where they would no longer feel alone. We have now made some progress toward that end by opening a center where mentally disabled people can receive health and social care, and more importantly, be part of a community, play games, do arts and crafts, cook, and have fun together. Minivans pick them up in the mornings and take them to the center. When I have time, I join them for a few hours. It comforts me to think that something good has grown from my family's dilemma and that perhaps my mother's immeasurable heartache was not in vain. Curing bodily wounds and alleviating physical pain is my job. I do my very best with what I have, but it often troubles me that there is no drug I could prescribe, no procedure I can perform to rid the soul of suffering or treat the wounds you cannot see. We hardly ever consider the emotional fragility of the people who come to us for help or the trauma they have suffered. We treat them unconsciously as beings with a different kind of psyche from our own, one that somehow deserves less attention. In fact, psychiatric care is crucial for people who have escaped famine or war. I can think of many instances in which I have felt powerless to help my patients. It has happened before, and it continues to happen. One day, a few years ago, 150 young people came ashore in a single boat. As always, I examined them on the pier. We usually check the hands for scabies. Then we ask the men to lift their sweaters and lower their trousers so we can inspect their bodies, since mites can also burrow into the skin on the back, buttocks, and groin. At one point, I was examining a 26-year-old man from Nigeria. I looked over his hands and had him lift his sweater, but I simply could not persuade him to lower his trousers. I started to explain why it was necessary, but he vigorously shook his head. He looked terrified. His insistence seemed odd, but I let it go and moved on to tend to the other patients. In the hours that followed, I could not help thinking about that young man and his stubborn refusal. I reckon he was probably just too modest to show us his private parts, but even so, his behavior had seemed peculiar. A couple of days later, the doctor at the reception center called me to say that one of the residents urgently needed to come to the clinic. He did not elaborate or indicate what the problem was, but he sounded worried. I told him I would see the patient and started preparing the necessary paperwork, including the Straniero Temporaneamente Presente form that allows migrants to receive free public health services throughout Italy. It is valid for 6 months and renewable for another 6. Many migrants are reluctant to get one because they do not want to be officially identifiable. But I always say that the document is essential because without it they will not be eligible for treatment in any public hospital. Whenever I take my part in a conference or medical seminar, I also try to hammer home its importance to my colleagues. I was just filling out the last part of the form when a young man appeared in the doorway. It was the one who would not let me examine his groin. I greeted him and asked him to undress, but he demurred, just as he had done on the pier. This time I said he could not refuse. If he had been sent here from the reception center, it must be because he needed medical attention. But he continued to resist. He appeared distressed and embarrassed. I did not know what to make of this trepidation. What was he afraid of? What could I possibly do to him? I was just beginning to grow nervous when he suddenly undid his belt, quickly unzipped his trousers, and lowered his briefs. My blood froze, and I felt sick. I could not look him in the eye because I was sure he read the horror in mine. I didn't know what to do. Above all, I did not know what to say. The man's testicles dangled between his legs, but above them was a hole. His penis had been completely severed. The unfortunate man had been castrated. I was aghast. At 26, this man had been robbed of any chance of leading a normal life. Now I understood why he had refused to undress, and why the doctor had not found the words to warn me about his condition. I had never encountered anything like this before. I pulled myself together and looked straight at him. His eyes betrayed 1,000 emotions. Most visibly, his great shame at having to sit there with his mutilated body laid bare. I asked him what had happened. He was silent for a few minutes. Then he found the strength to begin. I was doing well in Nigeria. I had a wonderful fiancée, and we were going to be married. We had dreams. We had wanted children. We were not well off, but we were not very poor either. I earned enough to support my family so we could live peacefully. I was happy. We were happy. Then one day, everything I had was destroyed. Years of love and hopes were ruined in an instant. I was out walking with my fiancée when a group of young men started making vulgar comments about her. At first I put up with it. She told me they would go away if I stayed calm. But those good-for-nothings only came closer and got nastier. I could not stand by any longer, so I confronted them. We got into a fight, but there was only one of me and there were 4 of them. My fiancée screamed, but no one intervened. That was when she ran back to my house to get help. In the meantime, my attackers went on beating me up. They punched and kicked me until I couldn't even feel the pain anymore. The blows were landing all over my body, my head, my stomach, my groin. I was on the ground, and my mouth was filling with dirt. Dust from the street had got into my eyes and nose, and I couldn't see a thing. I thought to myself that they would have to stop sooner or later, and told myself to hang in there. But those lowlifes were not done yet. They dragged me along the road until we reached an abandoned cabin. I was petrified. I had no idea what they wanted to do to me, though I had a feeling they would not kill me. And indeed, they did not kill me. They would have been too boring and ungratifying. What they wanted was to make sure my pain lasted forever, to destroy my masculinity, my ability to be a husband, a father, a man. The strongest of them took out a machete, while another stripped me naked. It only took a second. I saw the flash of the blade as it cut my penis off. They left me bleeding on the floor and ran away, brandishing my organ like a trophy. Before long, my friends had arrived, but it was too late. They took me to the hospital, and the surgeons operated on me. The emergency procedure saved my life, but I would rather have been murdered by those savages or left to die. From that point onward, my life has been meaningless. He paused. I was at a loss for words. He did not notice. He went on. I soon recovered and was discharged, but nothing was or would ever be the way it had been before. So I did the only thing I could have done. I left home, leaving everything behind. I attempted the journey to Europe. I didn't have the courage to face the consequences that this kind of mutilation would have in my country. I knew I would never be accepted the way I am. I could not look my fiancé, my friends, or even my mother in the face. Then he looked at me. Doctor, is there anything you can do for me? Please tell me there is some way of recovering what I've lost. Please say I'll be able to go back to living happily. I was almost not brave enough to tell him the truth. There was not much that could be done, and even an eventual prosthesis would only be for the sake of appearances. There was nothing I could honestly say to comfort or encourage him. And in that moment, I felt quite useless. As our consultation drew to a close, he thanked me for listening to his story and left, accompanied by one of the workers at the reception center. I sat at my desk for hours, stupefied and unable to do anything. The young Nigerian man spent several more days on Lampudesa. He came to see me again once or twice and said he was grateful to me, even though I had not been able to do anything for him. When his group left for Agrigento, I saw him off at the pier And that gracious, humiliated man embraced me and said farewell, smiling his melancholy smile at me one last time.